Hello, in this video we're going to be looking at antiemetics. Antiemetics, these are drugs or agents that prevent or relieve nausea and vomiting and can result from various factors such as surgery, vestibular disorders, and poisoning. The mechanism of action of these drugs is that they are dopamine antagonists and they act centrally by blocking the chemoreceptor trigger zone. Okay, so most of these antiemetics, they are phenothiazine derivatives, and when you're given antiemetics, these antiemetics should be prescribed only when the cause of vomiting is known, particularly in children. Otherwise, the symptomatic relief that they produce may delay or mask the diagnosis. So examples of antiemetics, we have Metoclopramide, also known as Placil or Maxolone. Okay. This drug is an effective antiemetic that has positive effect on the gastrointestinal motility, and gastric peristalsis is increased, leading to an increase in the gastric emptying rate. The action of this drug is that it is a blockade of dopamine receptors centrally on the chemoreceptor trigger zone, which is a part of the brain which, when stimulated by neurotransmitters dopamine evokes vomiting. So the indication for this drug is that it is indicated in nausea and vomiting, particularly in gastrointestinal disorders or during treatment with cytotoxic drugs. So Placil comes as a tablet of 5 milligrams and 10 milligrams. It also comes as a mixture of 5 milligrams per meal and as an injectable of 5 milligrams per meal. The dosage, in adults we give 10 milligrams 3 times a day before meals, or 10 milligrams intramuscular and intravenous. We also give 10 milligrams 3 times a day, 1 to 2 minutes after vomiting. Then in young adults between the ages of 15 to 19 years, we give 5 milligrams 3 times a day. Then when it comes to children, children are given according to the weight that they have. So a child up to 1 year who has weight of up to 10 kg, they are given 0.5 milligrams 3 times a day. Then a child 1 to 3 years with a weight of 10 to 14 kg, they are given 1 milligrams 3 times a day. A child between the ages of 3 to 5 years with a weight of 15 to 19 kg, they are given 2 milligrams 3 times a day. Then children between the ages of 5 to 9 years with a weight of 20 to 29 kg, they are given 2.5 milligrams 3 times a day. Then those children between the ages of 9 to 14 years and they have a weight of 30 kg and above, they are given 5 milligrams 3 times a day. Then the side effects of Placil is that there is extrapyramidal symptoms, especially in children. There is mutism, there is hypokinesia, there is tardive dyskinesia, which is uh, movements, which involves movements. There is chewing tongue protrusion, there are tremors of the limbs, there is drowsiness, there is diarrhea, constipation, drowsiness, and there is also nystagmus. Okay, so nystagmus, this is simply an involuntary eye movement, okay, which may cause the eye to rapidly move from side to side, up and down, or in a circle, and may cause a slight blurred vision. So this drug is contraindicated in pregnant women. It is also contraindicated in undiagnosed nausea and vomiting, especially in children and in young adults. The nursing implications for metoclopramide is that you should never mix the drug with penicillins, sodium bicarbonates, cephalosporins, and calcium gluconate. The reason for this is due to incompatibility of these drugs. Then you should also assess for any extrapyramidal effects such as tardive dyskinesia, grimacing, rigidity. Okay, so these are some of the things that you should assess for. You should also assess the mental status for symptoms of depression, anxiety, and irritability during treatment. Another example of antiemetics are phenothiazines. Now, phenothiazines are a group of drugs, and this includes chlorpromazine, prochlorperazine, trifluperazine, phenothiazine, and these are used for symptomatic relief of nausea from underlying diseases. So the mechanism of action for phenothiazines is that they are dopamine antagonists, and they act centrally by blocking the chemoreceptor trigger zone. They are of value for prophylaxis and treatment of nausea and vomiting associated with cancer diseases, radiation sickness, emesis, cytotoxic, and general anesthetics. The nursing implications for phenothiazines is that you should assess the respiratory status, that is the rate, the rhythm, increase in bronchial secretions, wheezing, chest tightness, and also provide fluid 1 to 2 liters per day to decrease secretion thickness. You should also monitor intake and output. Make sure that you look out for any urinary retention. Also monitor full blood count during long-term therapy, because there is blood dyscrasia which may occur. Okay. An example of phenothiazine is promethazine, also known as Phenergan. Its mechanism of action is that it acts centrally by blocking the chemoreceptor trigger zone, so it is the dopamine antagonist. Other action is that it acts as an antihistamine, antiemetics, and also as a sedative. The indication or the presentation, first of all, of promethazine is that it comes as a tablet, 10 milligrams and 25 milligrams. Then it also comes as an injectable containing 5 milligrams per 5 minutes. So the indication for promethazine is that it is indicated in various allergic conditions and also in nausea and vomiting. So the dosage that we give is 25 to 75 milligrams per oral or IM every 4 to 6 hours. Then for IV, we give 25 milligrams. So the side effects is that the patient might experience dry mouth, blurred visions, and also drowsiness. It is contraindicated in liver diseases.